So how far does your medical card go really in 2025? And what should employers be thinking about what if they want to genuinely support their teams? I'm delighted to say I'm joined in the studio by Stephen McLaren. He's Director of Corporate Solutions at 7 Insurance Brokers. Hi, Stephen. Thank you so much for coming on the show.
You're welcome. Good morning, Katie.
So I want to ask you for a start, Stephen. Have you found that customers are asking for mental health coverage now as part of their premium?
More so than before, but I would still say not enough. There's a lot of financial pressure on employers about the cost of medical insurance going up every single year. So it's more of a conversation as how do they keep the premiums down than adding more cover. So we're not there yet. And I think that probably leads on that the financial aspect from a decision for a company, the financial director leads it more than HR.
Because I should sort of say, Stephen is a broker and he supplies, on the whole, health insurance to companies, don't
Yes,
you, as
exactly.
opposed to individuals?
Yes.
Yeah. So they're probably always looking for the best deal. Have you, how much of an impact does it have on price, adding a comprehensive health insurance package?
Yeah, it depends on the network. So if you've got a better network, in other words, the more expensive clinics, then it's going to cost a bit more as a percentage, but certainly under 5% of the cover you're actually going to take out will be the cost. It can be as low as 1-2%. So in other words, if you wanted 10,000 dirhams, it could be 200 dirhams.
Wow, so it's not even that much, really.
On the better quality, the higher end of cost, if you're spending 10,000 dirhams on an employee, it's not a lot. But if you're spending 2,000, it's 10%.
Yes.
So it's all relative.
Oh, that's really hard, really, really hard. And we know that many policies technically include mental health coverage.
Yep.
As I said, I think in my previous interview with mine, I think it's 10 sessions, which if you have a crippling mental health condition, doesn't even scratch the surface. Sure. How accessible or even useful is the mental health coverage in practice?
Again, most of the time it's under-resourced in terms of the cover that you can get. Quite often it will be a number of sessions rather than a full amount up to the policy limit. Because if people do use it where they need it, it's going to increase premiums. So whether we were talking about mental health or dentistry, there's always an angle of we always want more. So the typical question an employer will say to me is, I want better cover for less money. And that doesn't keep going on.
It's not...
it's not feasible.
No, as my dad would say, I didn't fall off the Christmas tree.
Yeah.
So it just can't happen, can it? What's the road forward here then? People need better coverage, definitely in terms of their mental health. The survey suggests that as well. How can we get a happy medium?
I think employees need to start taking a bit more responsibility where they feel confident to say to their typically HR department saying, we don't have enough cover. Because it's ye who shouts loudest will get action. So I think there's going to be more discussion as we're doing today about the need for it. There are insurers trying to think a bit more innovatively. HealthX, for example, have brought in unlimited mental health calls as part of their package.
Calls?
Which I thought was fantastic. Calls, telephone calls, so it's not face-to-face, but at least it's something. And you've got employee assistance programs that are there, sometimes standalone. But again, they typically have a limit of how many sessions you can get, but it's better than nothing.
So this one this one insurer that you just mentioned, that's unlimited calls that people can make to a landline.
It's a company they partner with. They're in the process of changing who that is. But as soon as I saw that, I thought, tick box, well done, at least doing something innovative and trying to help.
Yeah, because we all know that with mental health, it is quite often talking about it first and foremost, which helps. And even if it's not face-to-face, that is definitely a step in the right direction. What companies, in your experience, are more likely to pay for health coverage? That includes mental health appointments. Is there like a type?
Blue chip, they've got the money and they understand the value and typically might have a global organisation that, as a philosophy, they need that cover. So it's more so that, no, this is what we stand for. We need to look after our employees.
And for those clients of yours that are individuals and do individual health insurance, is this something that they're asking for as well, a comprehensive mental health package?
The problem with the individual market is it tends to be that's the product, take it or leave it. You might be able to increase your dental, your maybe well-being, your optical, but mental health is not typically an option that you can say, I want that. And the reason for that will be the insurers will think if you're asking for it, you're probably going to use it.
Gosh.
Right, so it's not as flexible as we would want in the individual market. We don't have that flexible benefit platform to go, well, I want a bit more of that. Not yet. I don't think we're mature enough yet for that.
And it's almost discriminatory, isn't it? As in,
yes.
You're asking for it, therefore you're going to need it.
Yep.
Wow. Where's the road forward here then? What would you like to see change?
I mean, if employers could start just not looking at the bottom line, easy to say, difficult to do. It's taking a conscious decision going mental health is important. Most of them probably won't even understand the difference between absenteeism when you're not here and presenteeism when you are, but you're not really there mentally. There's a tremendous amount of that will be going on. And I think the MetLife studies of this world are important to bring it to the fore. So having an international organisation doing such a study, full marks.
Well, thank you. That is a really important point to make in terms of absenteeism, but presenteeism, but not actually being there. So sitting at your desk, but not being well of mind, therefore not being able to do your job. Really, really good point to make there. Thank you so much for your time this morning. That was the voice of Stephen McLaren. He's Director of Corporate Solutions at Seven Insurance Brokers. Would love to know what you think about this topic. How far do you go in terms of your health insurance? Does it cover mental health? Does it give you a comprehensive package? Or are you among the half of employees here in the UAE that feel perhaps they don't get enough mental health support from their company? Do get in touch. You can message me anonymously on 4001 or the WhatsApp number is 04871 5500.